There are only a handful of hospitals and clinics left on the Gaza Strip, and those that remain cannot cope with the number of patients and the severity of their injuries. Many are simply turned away. It's a desperate situation that surgeon Ghassan Abu Sitta knows well. He spent 40 days in northern Gaza performing hundreds of emergency procedures on little or no sleep, an experience he describes as apocalyptic.
Most of the injuries initially were blast injuries, and these were severe soft tissue traumas, severe facial traumas, multiple fractures. And then, as time went, we saw the introduction of incendiary bombs, where the patients would have over 40% of their total body surface area burnt with no other injuries.
Abu Sitta provided a pivotal voice from the medical front line, working at Al-Shifa Hospital, the territory's largest, until it ran out of supplies.
How do you evacuate 1,700 critically injured patients, 150 ventilated patients?
Back in London, he told journalists the Israelis will use the ceasefire to their military advantage, adding there are things in Gaza he can't get out of his mind.
By the time Shifa had been completely surrounded by the Israelis, there were 120 children at Shifa Hospital who were wounded children with no surviving families, some of whom were too young for us to even know their names.
You said that often it was the little things, the small things that were difficult to deal with.
Suddenly, you are hit with the life that was before, and it's the braid and the hairband and the.
Dr. Abu Sitta spoke for the medics, the injured and the bereaved, a voice from a territory that's become uninhabitable, he says. John Sparks, Sky News.